Well, this is Dr. Miriam at Innate, and we have our special guest, Miss Cece,
Hello.
on with us today. Welcome to everybody who is showing up. Hello to everybody that is coming on live in the I'm sorry, not live, in the replay. Put down in the comments, #replay if you're watching in the live replay. We can do those things here. So we're going to make this short and sweet, if we don't have any other questions, but, so today's live, as you guys have heard I think this is like our 6th live, I've talked about this one much on our lives, and, cause she's such an integral part of what we do here at Innate and how I believe that we are different when it comes to getting outcomes. So I've mentioned, and I'm going to mention again, 3-part approach. So it's the cells are a huge part of the underlying healing process. The testing is how are we optimizing the body? And then lastly, and almost most importantly, I would say, or equally as important, is our behaviors. And so Cece is phenomenal at helping parents understand that the behavior outcome they want, whether it is an actual change in something that they're doing, whether it is speech, whatever they're working on, trying new foods, there are specific ways to communicate with your child compared to a neurotypical child. And for many parents, even outside of ABA, and I'll let you maybe touch on that a little bit differently, but there are ways that she understands and works with families that is just different. And she's just phenomenal. And we see amazing outcomes when parents are working with her. And so we really are driving the point home with parents that it is not, let's do the cells and then hands off. No, let's do the cells that give your kiddo the capacity to understand what it is you're trying to teach them. And then let's make sure we're still teaching the behaviors, the boundaries, all those other things to actually get the outcome you want. And that's part of what Miss Cece helps us with. So, Miss Cece, if you don't mind telling our lovely parents and those watching what it is. Well, how did you get here? You've been with Innate so I was with Innate on and off for a couple years, and you were already with them kind of in that same like on a contractual.
Yeah, so I started consulting with Innate back in 2020.
Yeah.
And then came here full time in 2023. So been working with kids and with autism and stem cell therapy now for 5 years.
But before you were consulting, you worked with kiddos on your own.
Yeah, I used to have a program for kids on the spectrum, mostly kiddos that weren't really fitting in other environments. I kind of created a program for them specifically to work on things like communication, behavior, academia, life skills, pretty much anything you can imagine, to be honest.
Mm-hmm.
Yeah.
And so then the way that we work with our kids when they come in to see us is that you will spend some time with Cece when you are here. So whether you're here 2 days or 3 days. So just a reminder, any kids over 60 pounds, we can do the 300 million stem cells that we infuse over 2 days. Under 60 pounds, it's 3 days. So can you tell us a little bit about what you work with parents on while they're in the office?
Yeah, so usually on day 1, we go over a survey. So we're going to collect really good baseline information about where your kiddo is starting out at. And then I get a good idea of what you guys are looking for in that. And then the second day, we have a pretty full conversation about what your specific goals are for your child. And then we kind of break those down and make sure that we're doing everything that we can to optimize stem cell therapy and get as close to those goals as possible.
Absolutely. So we have a Jessie. Hello. So welcome. I know we had the I had to come in real close, Excuse the close up of my cores on my nose, but how long have we been doing stem cells for autism? Since 2016. Dr. Whitney has been working with stem cells and in the area of autism. Thank you for your question. Anybody else have a question, feel free to put it in the chat. And so that survey, if you for those that were on or have listened to our last Tuesdays, live, we talk about the surveys. We talked about how they go out a week before.
Right. Absolutely.
And so asking parents, like, when you have your appointment, look for that as benchmark.
Yes, it comes to you guys as benchmark. From our side, it's insights. But yes, filling that out is super helpful. That way we can really kind of dive deep into the review. If you don't fill it out, I have to sit there and fill it out with you, which is totally fine on my end, but it does take a little bit more time away from us being able to discuss it as much.
Yeah. And the questions are, what do they look like? What are the...
Yeah, so the questions are basically crafted to be able to see what kind of symptoms of autism your kid is exhibiting. So we basically want to actually get a higher score, and that is going to represent that we are displaying less symptoms of autism throughout stem cell therapy.
Because it gives, when you finish the survey, it gives a total score.
Yeah.
Right? And then symptoms of autism kind of go until this upper number.
Yeah. So there's back end work.
There's a lot. Yeah.
There's all you do is agree, disagree, strongly agree, strongly disagree, or pick neutral. But yeah, then those are all quantitated.
Quantitative.
In the background, and then we get a score from that, and then we try and get that score to go up.
Yeah, and it's really like I think you've had parents. You've told me you've had parents be like, "Well, where's my kid on this? On this scoring." It's not about like.
Right, yeah, we're not categorizing your children in any way, shape, or form. No, I made it very specific so that the goal is to just get the number higher, right? It helps us too, because if we do see a drop in it, we can then look at things that we need to address, and that kind of helps me and aids me in my position where I can say, okay, well, we're having a little more pickiness with some kind of situation here, then we need to look at that, and how do we help that kiddo learn what they need to learn to move past that. Whatever that might be.
Right. Yeah. And we talk about that often because parents will ask us, like, if the number drops. And one of the big things I say is that the safety of the cells is inherent in the fact that they're just healing cells. But I'll let them know, like, your kiddo might not go forward, but they're not going to go backwards. And so when we see what we would call like a dip, it's not necessarily regression, it's behavior changes.
Yeah, it's where you get into new things, them being like, oh, you know what? Actually, I have an opinion about that. Yeah. So it's really a cool thing because it does kind of show us a whole different concept of what's going on with your child. However, it can be startling to parents to see a number drop when they want to see the number go up. If it doesn't level itself out on its own, which it often does, then I absolutely will step in and help you guys figure out what you need to do to get that number going back up. But yeah, most of the time it's an increase in cognitive function that's creating some form of thinking, feeling, and understanding that's having a kid trying to express themselves in a different way or
not following the rules of what their parents want.
Yeah, they're doing kid stuff, honestly, and that's what we want to see. We just have to understand that, hey, your kid's doing kid stuff. How do we parent that child specifically to help them continue to optimize their abilities and develop?
Yeah. And that, I think, is a really important point because it is not about regressive behavior. It is actually about an increase in awareness that allows them to have greater choice and understanding than what they had before. But understanding, it's challenging for parents because you're like, well, they didn't do this before. Well, no, they didn't. But now they do because now they understand differently. I use your example all the time of like a kiddo with a red crayon that at school is they
ever cared about the red crayon before?
Ever cared about it.
Now we're wearing that red crayon and I want that red crayon.
Exactly. So, right, that's not a regressive behavior. That's an increase in understanding. But can that lead to maybe a tantrum, maybe throwing themselves on the floor? And so what you're saying is my kid's having tantrums.
Right.
Like, this is frustrating. Right. But let's understand what that tantrum's actually trying to tell us about their awareness. So that I like to really make sure parents understand that, because part of that expanding awareness consciousness is they're going to have increase in behaviors. And that is not a bad thing.
Yeah.
It's just a reparenting and trying to figure out where your kid is now.
Absolutely.
That question. So again, my pores. I'm going to go real close here.
Get in there, Dr. Miriam. You got it.
Do we have a play area before the kids get their stem cells?
We have a nice waiting room.
We have a nice waiting room.
It does have some sensory stuff in there, but not excessively.
Yeah. You're only in your first visit. We ask that parents come about 30 minutes early so that you can 15 to 30, so you can finalize consents, finalize payments, and all those financials and things. Outside of that, you're only with us for an hour after that. So it's not like you have to be here for an extended amount of time. We have TVs in the room. And so typically that's sufficient to entertain the kids for that hour. And if you want to, of course, if you want to bring some sort of toys or whatever, like the rooms are sufficiently big enough that where you could do that. But otherwise, no, we just have a lobby, a waiting area. You can, if they really need some space, one parent can walk around for a little bit in the building. It's just a big medical building. So that is always an option. Have you treated a kid who had apraxia? Did they talk after they got stem cells? Yes, and. So it depends.
Yeah, that's a good way to say it.
Jesse, how old is your kid? So it depends. There are, like, we get a lot of parents that will say, like, my kid's nonverbal. So apraxia, very much nonverbal. We get one nonverbal and they're like, oh, they still have words and they use them when they want. That's not actual nonverbal. At least not in our book, it's not.
Yeah.
Depending on who's classifying your kiddo. But what I will say is this. We definitely have kids that have apraxia that we have seen speech with. Speech, it's important to understand that, and you can speak this more. Speech is also a behavior. It's a learned behavior. So can you dive a little bit into what that means for kids with autism?
What I want parents to understand is what we're looking at for a kid who is nonverbal and on the spectrum is generally the idea that their first language is nonverbal communication. Whether or not they have words or not, generally that's what they're comfortable doing. And it's very likely that you have somewhat been conditioned to know what their wants and needs are. And we're kind of lowering their motivation to utilize verbal communication, right? So we want to view verbal communication as kind of secondary language that we're getting a kiddo to learn. So we have to kind of look at how do we go ahead and decrease that nonverbal communication while still being able to meet the kids' wants and needs and whatnot, and then increase the verbal communication.
Yeah. And that's where having a Cece is so helpful. Because she can really hone in on what's happening, right? What's happening? Where are the areas that she can help you guys understand where to work with your son or daughter? And so that's where it's really helpful. Every kid is different.
Kids are different. Families are different.
Yeah.
Yeah, there's a whole lot of things that go into it, which is why I do specifically take time to work with every single one of our families. It is not a one-size-fits-all situation. I want to know you. I want to know your kid. And I want to know specifically what we're looking for your child. And we're going to go ahead and basically give you just a concept of what you can take home with you to work on everything with them.
Yeah, so it's like a couple tips or tricks or things to work on while you're gone. This is not something like you leave here and there's like an extensive program, but the tips and tricks, and then people can, you can reach out if you have questions.
Usually just altering things. I have parents go, oh, so I have to change my behavior. And I'm like, well, yeah, to some degree, yes. Depending on where you're at. Yes, that is true for some people. But absolutely, yeah, it's more things that are that you can just integrate into your day-to-day life, and the way that you work with your child, and the way that you react to your child, and the way you communicate with your child, and the way that you're understanding your child's communication towards you. So I kind of help you figure all that out so that when you leave, you have kind of a little bit of an exciting time being like, okay, cool. I can help my kid even further now past receiving stem cell therapy.
Yeah, because I definitely know that there's a lot of parents that have, I think that kind of one-on-one piece of helping parents understand how the kiddo is seeing the world, and so how you can then best communicate can be a little different than some of the other therapies that are being done with the kid. And we definitely have, you say it all the time, like light bulbs go off in parents' heads, like, oh, I didn't understand it that way. And when we can understand our kid and what they're doing and why they're doing it, that changes everything.
It does.
And so we definitely see that. So Jesse, 3.5. Okay, I know.
Why did I started doing
speech, and she wouldn't categorize because
he can imitate sound.
He can imitate sounds. Okay. So right. So there's the aspect that's of speech that is a behavior. There's an aspect where we have a lot of parents that'll say like, hey, that they're trying to connect words and they're just not being quite able to. And approximations, right? You were saying the other day, it was really interesting that you were saying that sometimes kids actually have to watch you say the word.
Sure, yeah. A lot of it is, you'll notice a lot of kids on the spectrum are not really interested in looking at you. So you'll get a lot of kids who actually are trying to say a word, but because they've never been comfortable looking at a face and watching a mouth and no one's ever made them, you'll hear kind of like a mix of the word because they've never actually been able to copy the way that a mouth moves when it makes the word.
That's fascinating.
It is, yeah, it's really interesting. So a lot of kids you can, and obviously, again, different for all children, but there are a good handful at least of children that you can actually have them look at your mouth. There's a way to do this, and obviously that's what I will help you teach.
Yes, for sure.
Yeah, and it actually aids them in being able to get a little farther from the approximation and actually start to mold words in a more useful manner.
Yeah, and that's also where the cells come in. So that is one of those things that the stem cells in their attempts at healing, in their ability to heal the body, they're improving some of those neural networks. They're decreasing inflammation, so now the cells and the body can actually communicate in the way it's been trying to communicate, but maybe the inflammation is keeping them from doing that. So in that process, we definitely have kids, especially if they're already working with different therapies that are just not quite able to finish that connection, that after the cells, all of a sudden everything connects.
Yes.
Right? So that definitely is something that when we say the foundation really is the cells, it really does. And also, even after one visit, you can have increases in attention, eye contact.
Right, which all leads to
Making
all of this more possible.
Exactly. And so that's where then those changes the cells are undergoing in their body is going to help them in the long run, which is also why we say 4 visits tends to be like almost the minimum, because every time we're doing it, it's working on a different area. They're understanding something different. We're healing other aspects. So let me go back to Jesse's question about the apraxia. So behavior is one part. The other part, and this is something that we just started including in our testing. So when we look at how do we optimize the body, so we have the GI math to look at the gut microbiome. We have the urine test to look at toxins, both super important. The other one that we had kind of as an optional add-on, now we have included in our testing package, the integrative care add-on, is the FRAT test. So the FRAT test, if many of you have heard about it, or you've heard of the term leucovorin. Leucovorin is just B9, but it is in a reduced form. So when you take it orally, the body does not have to undergo any enzymatic reactions to break it down, which is really important because some kiddos cannot. Autism has with it a lot of kids have trouble breaking down those vitamins. So having them already reduced is really important. So leucovorin is just reduced B9. It is a medication because it's been patented by a company, but it is otherwise just reduced B9, reduced folic acid. This test, the FRAT test, is really important in speech. And I recommend, Jesse, if you just Google autism, spectrum disorder, or just autism, and either FRAT, F-R-A-T, or you Google cerebral folate deficiency and autism. Either one of those will bring up studies. And what the studies show is that 60 to 70% of kids with autism are positive for an antibody. So it's called an autoantibody. The body is producing and making this antibody from dairy, cow's dairy, any introduction to dairy. The body is producing this antibody. They circulate throughout the body. In the brain, they can sit in front of the receptors of the cell. So you have the cell, you have this little protruding receptor that's trying to grab at the folic acid as it's going past. The antibody either sits in front and blocks, or it actually attaches to and binds. And that's your result. Blocking or binding, are you positive or negative? What that does then, if they're positive at all, it means now you have a deficient state of folic acid in their brain. Their brain can't use folic acid, which the studies show leads to cognitive challenges, and speech is very heavily affected. And so we now include that test because as a baseline, to me, with anybody with autism, it's a must. That's also where the recommendation for dairy-free tends to come from, is that dairy is the main culprit. And so this is a way that we actually know, do we need to make that diet change or not? Because if they are positive for this autoantibody, it's a dairy change for life. If they're negative, not necessarily necessary, and the dosing changes. Double the dose for kids that are positive because we're trying to overcome that resistance that's happening because of the antibody, and just a standard dose of leucovorin for those that are not. And even the standard dose can make huge differences. We have a kiddo, I won't name names, but we have a kiddo who's about 10, did 4 rounds of cells, had tons of increase in awareness, tons of changes. Like, parents are really happy, but we didn't quite have speech. We introduced a basic dose of, and mind you, he was negative, but basic dose of the leucovorin, and within about a month, had 20 words. And you knew that they were there because he could type them out. He
Quite advanced otherwise.
quite advanced otherwise. So even if they are negative, it still tells us a lot and gives us a lot of information. And so that also can help with speech. So that could help with the potential apraxia. Again, we'll never guarantee it does, but we know that we're looking at the different steps to say how can we optimize, and that is one of them.
Try and take every approach.
But yes, we have seen speech improve. It tends to be a third, fourth, sometimes longer repeat infusion of cells. We don't call it a treatment. We call it more of a therapy. So we're not trying to treat anything. We are just trying to improve symptoms. So if you see me use the word therapy infusion as something else, because we're not trying to treat anything. Okay, so here we go again, close up. Is the urine test extra? It is an add-on. If you do any of the plans that is 1 visit, 2 or 3 visits, it's an add-on as a package. The urine and the GI map and the FRAT test all go together in this package. If you get the 4 visits and you choose that package, the 1.2 billion cells, that one, the testing is included already in that one. So it just depends on which one you get. If you're interested in working with us, you just call our main number, 602-603-3118. Option 1 gets you on the schedule or gets you to our patient care team that will get you on the schedule with myself or Dr. Ashley. We will go through those questions, and then at the end of that, we send a proposal to the front office. They will send it to you. Has everything broken down, and then you can call and look at any scheduling, timing, financial questions, any of those things. I hope that helps. I thank all of you who are here today and all of you that are watching our live replay.
I'm really excited about it. I really like the replay.
But let us know if you have questions. Again, instant message us. I think that's what they call it, right? Instant message.
I am, yeah.
I am. Leave it down in the comments or send us a email, info@innatehealthcare.org. We'd be happy to answer, and we will see you guys next time. Thanks.